So, respected chair and delegates, good afternoon. So, I'm Dr. Mithun Thulasidas. Today, I'll be talking about 24-hour diurnal intraocular pressure and water drinking test. Okay. Yeah. Yeah. So, basically, what is a quality-based IOP control? So, it includes major four factors. That is the mean IOP reduction, 24-hour IOP fluctuation control, a long-term IOP control and visual field stability, and a good response rate. So these four factors along with patient adherence, compliance and persistence makes it a quality-based IOP control. Now, what is the importance of 24-hour diurnal intraocular pressure in the current practice? So, there were studies which showed that a 24-hour monitoring resulted in a change of clinical management in around 79% of the patients. So, as you can see in the pictorial representation, the mean IOP differed by around 4 to 5 mm and the peak IOP differed by 12 millimeters of mercury when they compared the diurnal pressure with the in-office pressure. So definitely when the peak IOP values are far different from the in-office values, it definitely makes a difference in the management of the patients. Now when it comes to angle closure also, there is a 24-hour diurnal fluctuation which is more often in PACG and PAC eyes rather than PACS. So basically it correlates with the degree of peripheral anterior synechia and visual field loss, because if the peak IOP is more, then those patients will have more chance of PAS and visual field loss. So instantaneous IOP fluctuations can happen with many factors like size, change of body position, or when you drink a lot of water, or when you take exercise. So a sudden increase in IOP can occur with drinking of water, which we'll come to later. Lying positions, that is a supine position, is shown to increase the IOP compared to a sitting position. Most of the time in office hours we check the intraocular pressure in sitting position, but a nocturnal supine position will definitely show an increased intraocular pressure. And other autoregulatory mechanisms will also play a role. Now, how will we actually check the 24-hour diurnal intraocular pressure? Because we don't have much of devices which is readily usable to check the 24-hour IOP. So one device which is in literature which they use commonly is the contact lens sensor triggerfish by Sensibet. However, it does have its own side effects because basically it measures the intraocular pressure in millivolts and not in millimeters of mercury, which is a drawback, and other side effects related to cornea. Other device we have the home tonometers, which also we can use, and something known as iMate, but all these are not very standardized ways of checking 24-hour diurnal intraocular pressure. However, the basic concept is that you can see when they checked using these devices, there was a nocturnal acrophase which is seen in all the patients, but it was more marked in glaucoma. Even healthy subjects, as you can see the blue line, there was a spike in the intraocular pressure, but it was more marked when it came to primary open angle glaucoma patients. And there are two concepts. So there is a short-term IOP fluctuation and a long-term IOP fluctuation. So what is the importance of both? Most of the time we end up doing the long-term IOP fluctuation, that we check the IOP over a period of weeks or months, measured on several occasions, and we will come to a picture. But actually that doesn't matter. It is a short-term IOP fluctuation which is actually the IOP difference between the highest and lowest IOP over the course of 24 to 48 hours. This actually was identified as a risk factor for increase in visual field defects or increase in the cup area during 48 hours facing. So that is the importance of short-term IOP fluctuation, and that is the importance of 24-hour diurnal intraocular pressure check. And this is one study which cannot be taken for granted because they just showed the peak IOP varies between different types of glaucomas. However, most of the types will show a peak either in early morning or late night, whereas in secondary open angle glaucoma, they found it in the afternoon phase. So how does nocturnal IOP matter? So nocturnal supine IOP, especially in normal tension glaucoma, so when there is a nocturnal hypotension and a reduced ocular perfusion pressure, it can lead to compromised optic nerve circulation, along with an elevated IOP due to decreased outflow, hormonal changes, or direct pressure on the globe can also compromise the blood flow. So this basically helps in changing the therapy over 1/3 of patients, and those who had ocular hypertension also need to undergo a 24-hour diurnal intraocular pressure, because those who have a peak IOP more than 30 or those which have the maximum peak IOP are more prone to develop glaucoma in future. Also, it allows detection of false positive normal tension glaucoma among glaucoma suspects. So basically, you can have a personalized treatment based on the 24-hour IOP rhythm. You can actually choose the right time of application of the glaucoma medicine. It may reduce the rate of progression, improve the adherence, and it helps in identification of favorable and adverse behavioral and occupational patterns. So basically, it is an underused or underestimated test. But yes, with setting peak IOP, we can actually set the target IOP and improve the patient adherence. Now coming to water drinking test, it was initially abandoned due to lost sensitivity and specificity. However, nowadays it has gained sufficient attention. So this is how we perform. Usually the patient will be on liquid fast for 2 hours. Then the baseline IOP will be measured and a given volume of water, which is actually not standardized. Either you can give 1 liter or 10 ml kg can be given. Then the IOP is measured at 3 to 4 times at 15 minutes interval, and the highest IOP is chosen as the peak IOP. So the mechanism is unclear. It could be due to disturbance in the blood osmolality. It is reduced, it is related to the outflow facility. It can be due to centrally mediated mechanisms or either on the role of choroidal expansion. Now what is the importance of water drinking test is basically the peak IOP obtained with VDTs, WDTs actually corresponding to the IOP which is done using 24-hour diurnal fluctuation. So these are certain studies which again showed that similar IOP fluctuation and peak values were found in both PSCG and POAG. However, there's a strong correlation with outflow facility. Means if the outflow facility is good, then the peak IOP will be comparatively lesser and the return to baseline will be faster. So to summarize, it cannot be used for the diagnosis of glaucoma, but yes, you can use it as a stress test to evaluate the ability of the eye to deal with transient IOP elevations. And when we don't have much devices for IOP monitoring on a 24-hour basis, WDT is reproducible and shows clinically relevant results validated several times. Thank you for your